Ready? Go. Hi, good afternoon. I'm Angie,
And I'm Jenny.
and today we are focusing on tobacco as an addiction. So, tobacco use disorder is the problematic pattern of tobacco use leading to clinically significant impairment or distress as manifested by at least two of the following occurring within a 12-month period. Tobacco is often taken in larger amounts. There's a persistent desire. A great deal of time is spent in activities necessary to obtain tobacco. Craving or strong desire or urge to use. Recurrent tobacco use resulting in a failure to fulfill major obligations at work, school, or home. Continued tobacco use despite having persistent or recurrent social or interpersonal problems. Important social, occupational, or recreational activities are given up or reduced. Recurrent tobacco use in situations in which it is physically hazardous. Tobacco is continued despite knowledge of having a persistent or recurrent physical or psychological problem. Tolerance as defined by either of the following: need for markedly increased amount of tobacco, a markedly diminished effect with continued use, or withdraw as manifested by either of the following. The characteristic withdrawal symptom for tobacco refer to criteria A and B, and tobacco or closely related substance such as nicotine taken to relieve or avoid withdrawal system.
Okay, and the associated features that go with tobacco use is just one of the things is that it is the most preventable. It's a leading cause of preventable diseases, and tobacco use usually begins with adolescence, so at a very young age. Um, so tobacco can be used in many ways. So there's chewing tobacco, which is probably the oldest form of tobacco use, and there's also smoking tobacco, which is in your very common cigarettes. And cigarette smokes contain more than 7,000 chemicals, and 70 of those 7,000 can cause cancer. They concluded that nicotine exposure during the adolescence can harm the way your brain develops, and it can continue to harm your brain development until the age of 25. Nicotine exposure during adolescence can impact learning, memory, and attention, and it kind of prepares the brain for the addiction. Um, Chewing tobacco is a little bit more addictive than smoking because it brings more nicotine to the bloodstream when you're chewing it. Some of the features also that you'll see is mostly around someone's mouth. As you can see in the figure, there's swollen bleeding gums, um, there's the loss of teeth, smoker's palate, your tongue starts to feel a little hairy, very bad breath, yellow stained teeth, and so forth. So there's a lot, and your teeth can decay quicker. Um, so tobacco use in the middle school. So 1 in 14 students from middle school use tobacco. Among middle schoolers, e-cigarettes were also the most commonly used tobacco product today. They followed by cigarettes, which is the second most common, and then smokeless tobacco, which is the one that you would chew, cigars, hookah, and pipe tobacco. So those are in the order of what's most commonly used. There's been a recent increase in e-cigarettes amongst the youth because of the brand Juul. They have the electronic cigarettes that they have are appealing to the youth because there's USB shaped cigarettes that contain high levels of nicotine. And because it's so discreet and it's easy to hide, like the pens, the ones that you look like USBs, there's some that look like highlighters. It really appeals to the youth. They can sneak around and have it in the classrooms. And it's very dangerous because a single pre-filled liquid nicotine of Juul pod contains as much as a pack of cigarettes. So it's pretty widely spread.
Tobacco in high school. So more than 1 in 4 high school students currently use a tobacco product. In 2014, e-cigarettes, like Jenny mentioned, were the most common used tobacco product among middle school and high school. Between 2011 and 2014, there was a statistically significant increase in use of e-cigarettes and hookahs. 4.6 million middle and high school students continue to be exposed to harmful nicotine products. And in a research conducted in 2014, a total of 24.6 of high school students reported current use of tobacco product, including 12.7% who reported current use of more than 2 tobacco products. So it could have been an e-cigarette or regular cigarettes, the cigarillos. Here is a graph kind of showing tobacco product use amongst high school students in 2018, taken from the CDC. So the highest one that was used was e-cigarettes, followed by cigarettes and cigars. Some of the most antiquated would be the pipe tobacco, which is no longer a form that's used as much. And then tobacco use in college. Many students who started in high school or middle school can easily become addicted and continue that use in college. So tobacco use among college students increased through the 1990s, and prevalence among those 18 to 24 is currently the highest of all adult age groups at 29%. In a research conducted, 23% of full-time college students are current smokers. According to a study of 82% of students who had tried to quit, 75% remained smokers. And studies show that college smokers and tobacco users are more likely to experience depression, mental health problems, and generally have worse health outcomes during and after college. So here's another graph kind of showing the different percentage of students who either currently use or ever used some type of tobacco products in college. So again, cigarettes would be the highest, hookahs, cigars, and then the smokeless tobacco.
Okay, so the difference between experimenting and dependency of tobacco use is when you're experimenting with tobacco, like when you're smoking for the first time, it does increase the levels of dopamine and epinephrine in your brain, which occurs the dopamine to take place, and it gives you a sense of pleasure. And when you're experimenting, most likely it will, because the feeling of pleasure and the dopamine kicking in, it does most likely cause you to smoke again. When it turns into it can lead into the addiction, but because tobacco is extremely like addictive. So when you're experimenting, you still can become addictive, but when you're dependent on it, when there's a dependency, is when there's a physical reliance to the substance, like you need it to feel good physically and mentally. It's when you become dependent on it, obviously. And so over time, tobacco can cause physical dependency and emotional addiction, because it can cause, when you're dependent on it physically, you need it to feel. So some people believe like physically, for them to feel good, they have to smoke it. And then when you have a physical dependence towards tobacco, when you're trying to withdraw from it, it does create symptoms that might give you nausea, or make your increase in appetite. So it does affect you physically even more when you try to withdraw from it. That's the difference between when you're experimenting, which you can still become addicted, but not so much dependent on it, versus when you do eventually get dependent on tobacco. So right now I'm gonna show you a quick little video that kind of summarizes how cigarettes affect the body. There's a lot of changes that it does to your body, so I'm not going to bore you, and instead I'm going to show you this quick little video.
Cigarettes aren't good for us. That's hardly news. We've known about the dangers of smoking for decades. But how exactly do cigarettes harm us? Let's look at what happens as their ingredients make their way through our bodies and how we benefit physically when we finally give up smoking. With each inhalation, smoke brings its more than 5,000 chemical substances into contact with the body's tissues. From the start, tar, a black resinous material, begins to coat the teeth and gums, damaging tooth enamel and eventually causing decay. Over time, smoke also damages nerve endings in the nose, causing loss of smell. Inside the airways and lungs, smoke increases the likelihood of infections, as well as chronic diseases like bronchitis and emphysema. It does this by damaging the cilia, tiny hair-like structures whose job it is to keep the airways clean. It then fills the alveoli, tiny air sacs that enable the exchange of oxygen and carbon dioxide between the lungs and blood. A toxic gas called carbon monoxide crosses that membrane into the blood, binding to hemoglobin and displacing the oxygen it would usually have transported around the body. That's one of the reasons smoking can lead to oxygen deprivation and shortness of breath. Within about 10 seconds, the bloodstream carries a stimulant called nicotine to the brain, triggering the release of dopamine and other neurotransmitters, including endorphins, that create the pleasurable sensations which make smoking highly addictive. Nicotine and other chemicals from the cigarette simultaneously cause constriction of blood vessels and damage their delicate endothelial lining, restricting blood flow. These vascular effects lead to thickening of blood vessel walls and enhance blood platelet stickiness, increasing the likelihood that clots will form and trigger heart attacks and strokes. Many of the chemicals inside cigarettes can trigger dangerous mutations in the body's DNA that make cancers form. Additionally, ingredients like arsenic and nickel may disrupt the process of DNA repair, thus compromising the body's ability to fight many cancers. In fact, about 1 of every 3 cancer deaths in the United States is caused by smoking. And it's not just lung cancer. Smoking can cause cancer in multiple tissues and organs, as well as damaged eyesight and weakened bones. It makes it harder for women to get pregnant, and in men, it can cause erectile dysfunction. But for those who quit smoking, there's a huge positive upside with almost immediate and long-lasting physical benefits. Just 20 minutes after a smoker's final cigarette, their heart rate and blood pressure begin to return to normal. After 12 hours, carbon monoxide levels stabilize, increasing the blood's oxygen carrying capacity. A day after ceasing, heart attack risk begins to decrease as blood pressure and heart rates normalize. After 2 days, the nerve endings responsible for smell and taste start to recover. Lungs become healthier after about 1 month, with less coughing and shortness of breath. The delicate, hair-like cilia in the airways and lungs start recovering within weeks and are restored after 9 months, improving resistance to infection. By the 1-year anniversary of quitting, heart disease risk plummets to half as blood vessel function improves. 5 years in, the chance of a clot forming dramatically declines, and the risk of stroke continues to reduce. After 10 years, the chances of developing fatal lung cancer go down by 50%, probably because the body's ability to repair DNA is once again restored. 15 years in, the likelihood of developing coronary heart disease is essentially the same as that of a non-smoker. There's no point pretending this is all easy to achieve. Quitting can lead to anxiety and depression resulting from nicotine withdrawal. But fortunately, such effects are usually temporary, and quitting is getting easier thanks to a growing arsenal of tools. Nicotine replacement therapy through gum, skin patches, lozenges, and sprays may help wean smokers off cigarettes. They work by stimulating nicotine receptors in the brain and thus preventing withdrawal symptoms without the addition of other harmful chemicals. Counseling and support groups, cognitive behavioral therapy, and moderate intensity exercise also help smokers stay cigarette-free. That's good news, since quitting puts you and your body on the path back to health. If you want to see more videos on building healthy habits, check out this playlist. And if you want to help support TED-Ed's non-profit mission, please.
Okay, so that was a good summary of pretty much everything that it does to your body and then withdrawals. Emotional consequences of tobacco, some of it was mentioned in the video, but smoking tobacco can make people feel anxious and irritable. So, which can alter behavior and cause someone to smoke a little bit more than usual. If somebody is already kind of an anxious person, smoking can actually worsen your anxiety. And also, it for a brief moment, it might elevate the mood and create pleasure, which is why people use it mostly when they're feeling sad and angry or frustrated. But the truth is that with long use of it, it can eventually just alter your emotions because it does cause chemical reactions in the brain and there could be imbalances. But that's why when people try to quit and they withdraw from it, you're more likely to get depression, sadness, or grief, a sense of loss, frustration, impatient, angry. You'll get anxiety. You're a little bit more irritable. You'll have trouble concentrating. You might feel bored and also restless at the same time. So there's a lot of emotional consequences that come after when you try to withdraw from tobacco.
Some of the psychological consequences, if somebody is already suffering from psychological disorders or is mentally unwell, kind of like Jenny mentioned, if somebody's already suffering from anxiety, then the tobacco use can worsen the symptoms of that disorder. Tobacco causes changes in brain chemistry, which can cause all sorts of issues and affect your thought process, your mood, and for adolescents, their brain development. Some of the social consequences, the physical consequences can affect the social life of a tobacco user due to the bad breath, smelly clothes, yellow teeth. It can definitely also affect just their interactions in social situations in which they feel like they need to go ahead and smoke. They have constant smoke breaks. Another social consequence is tobacco products are very expensive, that for some people it can affect their social life because their finances are impacted. Secondhand smoking also affects relationships with your family, your friends, and children because it is dangerous to their health. And society also really frowns upon secondhand smoking. Over time, the way that tobacco users socializes changes and they tend to connect with other tobacco users versus someone who does not smoke or use tobacco. Some of the treatment strategies.
Yeah, so for treatment strategies, so physically, people begin to treat themselves with the nicotine replacement therapies and medicine prescribed by a doctor. So there's two medications that they can use that would help, and I'll go over the nicotine replacement therapy. So, like mentioned in the video, so nicotine patches is a huge one, which is a small adhesive patch that you would put on an area that's like a hairless area of your body, and you apply a new patch every day on a hairless area between your waist and your neck, such as your upper arm or on your chest. It's available in various doses. It's easy to use, and it can be combined with the other aids like the gum or the inhaler. The only thing about the nicotine patch is that it can cause skin itching, rash, or irritation, and it also can cause insomnia or vivid dreams. The nicotine gum is also a very common one. And so through the chewing, your body absorbs it, and it can be used 1 to 2 hours, every 1 to 2 hours, 24 pieces a day. So it's pretty easy to use. It's available without a prescription. It can control sudden nicotine cravings. So if you felt like you would want to smoke or chew or whatever, you would take the gum instead. And it can also be used with, like I said, like the patches and stuff like that. The only thing about the nicotine gum is that it can cause mouth irritation, jaw soreness, heartburn, hiccups, or nausea. And it can stick or damage your dental appliances if you if an adolescent were to quit and they wear braces, it can affect their braces. The nicotine lozenge are the pills that you see right there, those little white pills. Those contain small amounts of nicotine, and you place it between your gum line and your cheek and suck on it slowly, allowing it to dissolve. And that way the nicotine enters your bloodstream as it's absorbed, kind of like a mint. And they're available also without prescription. It can control sudden nicotine cravings and withdrawal symptoms. They're available in, they don't require chewing, they don't stick to your dental appliances, which is good. And it can also be combined with the other aids. The only thing that it can cause is mouth irritation, hiccups, heartburn, or nausea. There's a nicotine inhaler, which is the bottom one under the nasal spray. That one can also control sudden nicotine cravings and withdrawal symptoms. It allows you to control the dose of the nicotine you receive, so you can change the dosage, and it can also be combined with the other one. The thing about the inhaler is that it's only available by prescription. It can cause mouth or throat irritation, and it might not be a good idea if you already have a breathing condition such as asthma. The nicotine nasal spray kind of gives you the nicotine through your nostrils, a small dose of nicotine, and it's recommended in 1 to 2 sprays in each nostril once or twice an hour. It can control, same thing, sudden cravings of the nicotine. It works a little bit faster than all the other nicotine replacements, and also allows you to control the amount of the dosage that you're going to be using, and it can also be combined with the other nicotine replacements. It's only available by prescription as well, and it must be used repeatedly throughout the day to control the cravings. The problem with it is that it can cause nasal and throat irritation, sneezing, coughing, or watery eyes. And then the 2 medicines that need to be prescribed by the doctor is the bupropion, which is a pill. It's easy to use. It can be combined with the other aids. It may reduce the weight gain many smokers experience after quitting cigarettes, so that's kind of good. The only thing is that it can cause dry mouth, headaches, or insomnia, and it can change your mood and behavior. And then the second medicine is varenicline, something like that, and it can reduce your tobacco cravings and control your nicotine withdrawal symptoms, and it can be used also with the other aids. It's also only available by prescription and can also cause nausea, insomnia, vivid or strange dreams, and also causes change in mood and behavior. In regards to your emotional and mental treatment strategies, counseling would be your best bet. Self-help materials, and then of course support groups would also help you in regards to your mental and emotional health and treatment.
So just to follow up on effective treatment data, first-line treatments for smoking cessation are nicotine replacement therapy and varenicline, which is one of the medications Jenny mentioned. Varenicline attaches to the nicotine receptor so that the nicotine can't. With varenicline, dopamine is still released, but less so than with nicotine. And it's believed that these actions are how varenicline may help you quit smoking. One specific study demonstrated how those allocated to the varenicline group were 1.57 times more likely to remain abstinent 6 months after treatment. According to the Cancer Network, pharmacological treatment of nicotine addiction combined with behavioral support will enable 20 to 25% of users to remain abstinent at 1-year follow-up. In one study conducted, only an offer of pharmacotherapy was independently associated with increased cessation at the time of the 12-month follow-up. So like Jenny mentioned, it is a combination of treatment that would be most beneficial for the patient. Here we are just going to discuss some of the resources available in Orange County. One that I found was through New Lung, which this was found on the Orange County Healthcare Agency website. This offers a variety of different meetings available for the month of March. They offer 4 types of services to adults, which would be 5-session class series, one-on-one counseling, telephone counseling with a one-time 90-minute seminar or a 45-minute seminar. It's offered in English, Spanish, Vietnamese, Korean, and Farsi. There are free nicotine patches available to adults 18 and older who complete any of the adult cessation services. And there are the teens can receive 2 types of services, which would be 5-session class series and a one-time seminar. Another resource available in Orange County, so these do kind of target more of the adolescents, would be Orange County's Healthier Together, Improving Health Through Planning and Partnerships. This is Not on Tobacco, which is a smoking cessation program designed for 14 to 19-year-olds. It's based on social cognitive theory and incorporates training in self-management and stimulus control, social skills and social influence, stress management, relapse prevention, and techniques to manage nicotine withdrawal, weight management, and family and peer pressure. NOT consists of 50-minute group sessions recommended for a weekly dosage of 10 consecutive weeks. And these are usually teachers or school nurses, counselors are trained specifically by the American Lung Association to facilitate sessions in schools and other community settings. And our last one is aimed more at the prevention, but this is something that's available at several Orange County schools, which is a tobacco use prevention education program brought by the Department of Education, which is aimed to reduce youth tobacco use by helping young people make healthy tobacco-related decisions through tobacco-specific research, validated educational instruction, and activities that build the knowledge. So they usually will go into the schools to talk about alcohol, tobacco, and other drug prevention curricula, youth development activities, and tobacco use cessation services, and tobacco use intervention services. So this one aims more at the prevention and the intervention, but they also do offer the cessation services. And that's the end.
That concludes our presentation. Thank you so much for listening to us. Bean.
Thank you for watching.